Inflammatory bowel disease or IBD is a chronic, typically more than 4 weeks duration problem seen in both dogs and cats, similar to Crohn's disease in humans. IBD is caused by an abnormal immune response or hypersensitivity, causing inflammation within gastrointestinal tract. This can be driven by genetic, food allergies, parasites, bacteria, and broad-spectrum antibiotic therapy. When an animal has IBD, the lining of the stomach or intestines is invaded by inflammatory cells. IBD can involve the stomach, which is called gastritis, small intestines, which is called enteritis, large intestines, which is called colitis, or all three. The continuing inflammation damages the lining of the digestive tract in a way that prevents food from being properly digested. What are the clinical signs of IBD? If the stomach is involved, your pet will experience chronic intermittent vomiting. If the intestines are involved, chronic diarrhea will occur. If all parts of the digestive tract are involved, both vomiting and diarrhea occur. If the syndrome lasts more than a few months, weight loss and poor appetite are common. How is IBD diagnosed? A set of blood tests we may recommend for patients with chronic gastrointestinal disease is called a GI panel. This test looks at the cobalamin, vitamin B12 level, which is often low with IBD. It measures folate, which decreases in IBD, and increases when there is an overgrowth of harmful intestinal bacteria. It also includes a PLI test, which is a marker for pancreatitis, and TLI, which tell us whether the pancreas is making enough enzymes to digest food properly. An abdominal ultrasound can also suggest that IBD is present. Intestinal biopsies, which is taken under general anesthesia, is the best way to tell what types of inflammatory cells are involved. What is the treatment of IBD? The first steps to treatment are to eliminate any parasites or food substances which may be triggering hypersensitivity reactions. The most common parasites involved are Giardia and Coccidia, which don't disappear with broad-spectrum antiparasitic therapy. 2. Another standard treatment is the bland diet, which includes ground cooked turkey, canned pumpkin, or cooked sweet potatoes. 3. We balance the use of antibiotics against the risk of wiping out too many of the good bacteria which normally present in the intestines. Many times this means giving probiotics at the same time we are giving antibiotics. 4. For decreasing inflammation, we start with metronidazole for dogs initially, but usually go right to prednisolone in cats. Other anti-inflammatory drugs such as sulfasalazine is a great help when IBD involves the colon. 5. Regular B12 injections or oral B12 supplementation is usually recommended. An oral vitamin E supplement may also be recommended. IBD can be frustrating and difficult disease. The goal is not to cure it, but to control it, to minimize the frequency and severity of flare-ups, and to maximize the quality of a pet's life.